fighting to regain control. They aim to build both physical and mental strength. After a heroin addiction spanning 30 years, Mark said he had reached the end of the road. He entered residential rehab with chronic health problems caused by decades of injecting.
I'm very lucky I kept my legs this time. I've been warned for the last 10 years, you know what I mean? I'm going to lose my legs, but I kept on, I couldn't stop. I actually came in 2 days late because I was in Glasgow Royal.
This gym gives Jericho House a reduced rate for these sessions as it knows money is tight. Despite recovery rates that exceed the national average, the drug treatment project in Greenock receives no statutory funding. Over the last year, the service has been pushed to the brink and it's sold off 3 of its properties to make ends meet.
Well, desperate, we're in a desperate position and we don't have anything left to sell. The promises that we would get the money that we were due, it never materialised.
The advice of a former resident or a key worker led some of these men to Jericho House. Staff rely on volunteers to help deliver the service. Of the 670 men and women who have completed the project, only 5 have had a bed funded by their local authority. While residents can apply for housing benefit, the service covers the main cost. The bill for each person, £250 a week. Most stay for 6 months.
I'm only in 50 days, so I've got a lot of time to go, but so far so good. I need to remember, this is what I want in life. I don't want to be back using drugs and that suicidal thought process all the time and all that. I don't want that, especially not for my kids either, so I want to be a good dad for them.
One local authority's used 42% of the 670 bed spaces in the last 17 years, and we've never received a penny from that local authority, and we've provided a service to 30 of the 32 local authorities in Scotland.
Good evening, Abacare Group, Gordon speaking. And how long have you had a problem for?
You can access a detox bed here within hours of making a phone call, but you need thousands of pounds. This private service in Lanarkshire, like many others across the UK, is under-occupied.
Every 20 phone calls, one may be afford to come to clinic themselves. And we get hundreds of phone calls a month. Just recently I looked back to look at specific drugs, which was methadone, opiate only, and there was 500 calls in a 9-month period. Specifically people on methadone, and every conversation had an element of been on it for a long time, feel hopeless and useless.
There has been a shift towards more harm reduction programmes such as methadone and community-based services. Abacare say they rarely have a referral from a Scottish local authority, and those who try this route face months of red tape.
We're certainly frustrated, concerned, because we know the value of this type of service. Residential rehab saves lives and changes lives. We would be open to meeting with any commissioners to discuss spot purchasing of beds. If residential rehabilitation services aren't, further invested in, we may find ourselves with even more of them closing.
My spirit was completely broken. I mean, I couldn't function. I had to come in somewhere and just start from the beginning, you know what I mean? And it's difficult, but it's worth it.
Some experts argue that with abstinence-based programmes, there is a high risk of relapse. Here, whether they are treated for a drug or alcohol problem, many return for aftercare. Meetings offer much-needed support.
People have not got a chance to tap into services. A lot of people maybe in working environment and in their jobs, hiding their addiction or not want to speak to anybody about the struggles that they're having. So they're never going to be included in these sort of numbers because they're sort of hidden.
I just found myself in here as a result of people that love me. I just remember waking up one day and saying, I can't remember the last day I never took drugs.
When Sean's cocaine addiction became impossible to hide, he says he found NHS help difficult to access.
I waited 6 months and I got a reply saying that they wouldn't be able to offer me a methadone prescription. I wasn't on opiate-based drugs. I wasn't on heroin, so I didn't need a methadone prescription. My confidence in the NHS for that, for addiction, just went out the window, and I just went, nobody can help me now.
Additional funding has been promised for alcohol and drug partnerships, and Scotland's Public Health Minister is to visit Jericho House later this month. Before arriving in Greenock, Lee had 2 weeks of private detox. At his lowest point, he was homeless and begging on the streets of Stirling.
I've been really lucky. The past experience I've had with rehabs have been paid by other people for me. But I think that the system, full stop, isn't working. I've lost a lot of friends over the years to addiction, a lot of really close friends. And even since I've been in here, I've heard of 3 or 4 people that have passed away through addiction. By the time I'd got to the end of my using, I was in complete despair. There was no hope. So I feel very lucky to have my bed, and I use that as a motivator when I'm having difficult times. I try and remember where I come from to keep me here.